Aha.
Happy New Year, viewers and listeners of Health Matters. Health is Worth and Worth is Health on ABL Television, where informations are brought to your doorsteps 24/7 on Freeview, IPTV on ABL Television, YouTube, Snapchat, Facebook, and all the other social handlers. I am your host, Ama Sichibia. I hope viewers, your Christmas and New Year celebration went well, and you stay safe. Today, before I start the topic for today, which is heart attack, I would like to introduce my co-host Gladys to come and say a few words to our viewers, because it's been a while and we are in a new year. And the message, and I hope there's something that she wants to say to our viewers. But as we wait for her to say whatever she have to say to us, I will urge you all to subscribe, share, comment, like, and press the notification button so that others can also come and get this information or this discussion that we are going to have today. As I always say, invite a friend to also invite a friend to also invite somebody to come and listen. As you share the words, as you share this information, you never know who you are going to save, because information shared is information spread, and it can save someone's life. So as I said, today we are going to talk about heart attack. And what do you mean? What do I say is heart attack? I know we've been hearing all this. Someone has had a heart attack and all that. So what do we say? What do we call? So when we say heart attack, what do we say heart attack? But before I explain what attack means, I can see that my co-host is on live now. So I will just introduce her. Hello, Gladys. I wish you and your family a happy new year. And I'm happy to have you live on ABL. Do you want to say something small to us before I continue with the discussion we have today? You are welcome, Gladys.
Oh, thank you. A happy new year to you and your family and all the listeners as well. We thank God for another year, and you're doing an incredible job. And just want to say, listeners should keep listening, as you've said, to share. And there are lots of amazing program lined up for this year. So as we go ahead planning for our new year and having our new year plans, we should also add health plans to our new year resolution. So together we have a better health for this year. Thank you, Ama.
Thank you, Gladys. That's well spoken. And hopefully we'll be hosting together next week on another important topic. So thank you, and see you next week, Gladys.
See you.
Okay, viewers, welcome back. As we've had those words from my co-host. Before we went, I was saying today's discussion is going to be on heart attack. So heart attack, also known as myocardial infarction, or MI in short form, is when the supply of blood to the heart is blocked by a blood clot. So when this blood flow to the heart is blocked, then it damages the muscles of the heart, which lack of this blood to the heart is a very serious health condition, or it's an emergency, life-threatening emergency, which when you suspect any of the symptoms I'm going to talk about, or you suspect in anyone you know or your loved ones, you immediately have to call 999, ask for ambulance, and they will take you straight to A&E, where you will receive the treatment that is needed, as time is very essential when it's come to heart attack. So what are some of the symptoms that will enable you to know whether you or your loved ones or someone you are looking after is having a heart attack? So some of the symptoms are chest pain. Some of the chest pain, when we say chest pain, some people experience like tightness, they have squeeze, they feel their heart is big, their chest is squeezing, pressure of the heart, heaviness of the heart, and sometimes this chest pain, the pain from the chest radiates to the other part of their bodies. Most time is they say left side of their body, but it can be any part. But most people say they experience it at the left side of their body, their jaw, their neck, their hands, their body. You feel the pain radiating to almost every part of your body. Also feeling lightheaded, dizziness, feeling sweaty, shortness of breath, feeling sick, nausea or want to vomit, feeling sick, overwhelming. Some people feel they have a panic attack, or also coughing and wheezing. So these are some of the symptoms. The symptoms some people experience either one or two, or it can be all the symptoms. Most of the time when you talk to people, they talk about chest pain. Yes, chest pain is the most common of the symptoms, but it can be any of them. As recently, there was a survey that they did, and there's this woman who was saying that even when she was in the hospital, she was even making fun, joking on her phone until the doctors told her that you had a heart attack. She didn't know because she wasn't having chest pain. She was having wheeziness, coughing, and so everyone is different. Everyone and the way it can affect them. So if we know what the symptoms is, if we know what heart attack is, then what is the cause? What causes heart attack? So if you are somebody who has any heart problems or heart disease, which the common ones would be coronary heart disease, that is a CHD, then you are likely to have a heart attack in your lifetime. If you smoke, if you have a high cholesterol, diabetes, high blood pressure, you are likely to have a heart attack. If you are overweight, obese, you don't exercise, lack of exercise, you eat, go and sleep. As you eat, sleep without exercising, you don't burn the fat in your body, so it piles up, which then you end up, if this fat blocks the blood supply to your heart, it will cause you to have a heart attack. Thrombosis, some people have DVTs, that's clot problems. As I was explaining what heart attack is, sometimes when the supply of the heart, the blood to the heart blocks with blood clot, with fats, it causes this heart attack. So if you have issue with blood clot, that's thrombosis, it can cause a heart attack. Then there are some less common causes, which is drug misuse. When some people misuse drugs, it can restrict the flow of blood into their heart, which will cause them to have a heart attack, which we call in a short form MI. and lack of oxygen. Some of this lack of oxygen as well can also cause heart attack. And when I was saying misuse of drugs, there was a survey that was done by the British Heart Foundation, who found out that most of the common death caused in young people by due to heart attack was by misuse of cocaine, which, because cocaine is a very high, drug which restricts the flow of blood into the heart. So when they did that survey, the research, that's what they found out. So please, if you are misusing any medication, please, you need to seek help. How do we diagnose heart attack, or how does heart attack is diagnosed? As I said, it's a medical emergency. So immediately you see or you notice any of the symptoms I've mentioned, quickly call ambulance, go to the hospital. And when you get to the hospital, they will have a trace of your heart. You see, they'll put a sticker on you, your body, your legs, that they'll get a trace, because this ECG will help the practitioners to determine what treatment to give you, or how serious your heart, the muscles of your heart has been affected, has been damaged. So ECG is used, and also there are other tests such as blood tests. They'll take some blood from you, chest X-ray, and also they do a scan as well, which will also of your heart, which will determine, because when the supply of blood to your heart is blocked, it damages the muscles. So you're depending on how the muscles of your heart has been damaged, will determine the treatment. So knowing the cause of heart attack, knowing how it's diagnosed, then how do they treat it? So the treatment normally depends on how the time factor, or how severe your muscles has been affected. So if your symptoms started within the past 12 hours, then you will be given what we call the primary precocious coronary intervention, which is a PCI treatment, whereby you are giving some injections or tablets in order to either dissolve the blood clots that have been formed in your blood vessels, or to prevent any blood clot that is about to form in your blood vessels. And there are other medicines that are given, that 4 types of medication to treat the blood clots, which are the ACE inhibitors. You hear antiplatelets, beta blockers, and statins, and sometimes aspirin as well. Statins, aspirin, because it dissolves the blood clots, or it prevents blood clots from happening. And so if you've had a heart attack and you've been in the hospital, there are a lot of things that it can help you to recover. And there are a lot of multidisciplinary team that will help you as well before you even leave the hospital. So we have the nurses, the nurse practitioner, which is the cardiac nurse. We have the physiotherapists. We have the exercise specialists. We have the cardiologists. We also have the pharmacists, dietitians, that will also help you enable in your recovery position. So please, when you are leaving the hospital and you are given this care package, please, when you get home, that shouldn't be the end. They are there to support you. They are there to direct you. And even these people can even signpost you if you're having problems with your finances, you're having problems with your social housing, you're having problems with welfare. They are the people who, because you have to remember, they are there, they've seen you are not the first person for them to be treated, for you to be treated from this heart attack. They've been doing this for a while. So anything that you want to, you want to ask them, if you want them to signpost you, even therapists, psychologists, they are the best people you can talk to. So they are there to support you in the recovery position. Or even if you have a loved one that you feel overwhelmed with looking after because they've had heart attack, they are there for you to go and consult them, to talk to them and follow. So in the cardiac rehabilitation, they are there. They give you a program in the hospital, then they come to your home and they can follow you other sessions, like 10 days of leaving the hospital. They'll follow you after 10 days, even after you've left the hospital, whereby they will monitor you, make sure that your breathing, your heart is working well. So they are the team you have to also, engage with well. And we have the exercise specialist, because as our heart pumps blood to our body, which helps our body to function. So when you've had this heart attack, sometimes it weakens your strength, it weakens the way you do things. So the exercise specialists, they are there to help you to put a regime in place for you. If you are someone who were going to the gym 24/7, or you were someone who were active, these exercise specialists are there to help you put things in place. They will tell, oh, now you don't need to go to the gym now because it will not be good for your health. You have to start with walking the stairs, or using the swimming, or walking once a day, once a week. So they are there to guide you. So they will help you with your recovery time. Also, there is a team who also help you in your in recovery, by helping you if you were someone who was working, or who were working. They are there to help you to go back to work if you want to return to work. I keep on saying, depending on how severe your heart attack was, or how damaged your heart muscles was, this, when you want to return back to work, depending, some people, if it's mild, within 2 to 4 weeks, they are able to go back to work. With the support of this team, they will help you get back to your feet to go back to work. But then others, if it affected them severely, sometimes it might take more than that 4 weeks, 2 to 4 weeks. It might be even 6 weeks, but it all depends on your health. If you had any other health complications, then they will make that plan, assess you, and then they will put things in place and advise you as needed. And according to the British Heart Foundation, having a heart attack does not stop you from having sex forever. Usually about 4 to 6 weeks after having heart attack, you can go back to having sex. Driving, you can still drive. You don't need to, after you've recovered fully, that is the word. After you've recovered fully, you can go back to driving. You don't need to notify DVLA. You only notify them if you have any other health conditions aside the heart attack. But if it's solely heart attack that you've had, you don't need to notify DVLA. But you remember, if you have diabetes type 1 on insulin, and then you need to also inform DVLA. But if it's only heart attack, you don't need to alert DVLA. Some people, they can return to driving after 1 week, 1 to 2 weeks, or 3 weeks, but it all depends on how you are feeling, how you're recovering is. Because others in the recovering position, because as I said, heart attack, to see someone had heart attack, sometimes it's traumatic. It's so it's traumatic. It's frightening. So if you are somebody who experienced that, or you even experience a loved one go through that or had a heart attack, and sometimes you develop anxiety or depression. If you are someone like that, please, you need to speak with your doctor, speak with your GP, who will refer you to a psychologist that will help you through that period. Or you can self-refer yourself to the talking therapy, to the psychologist, who will help you, because you don't need to, sit there silence, because it can affect the life of your family as well. So there's help out there if you are having any depression or anxiety. So as I said, everyone, you can get help depending on how you are feeling. Anyone that experiences heart attack, everyone is different. They face different problems and different challenges. So depending on your challenges that you are facing after you've had a heart attack, or after someone you know have had a heart attack, depending on the challenges they are going through or the family is going through, will depend on the help that you can get. And if you don't want to go to your GP, you can go to the British Heart Foundation, or in your country, wherever you are, there will be a heart foundation there which you can consult or you can contact, and then they will give you the help or signpost you to where to get help. So if someone has had a heart attack, there are some complications that they will be left with. Let me put it that way. If you had no heart problems and you end up having heart attack, remember our heart is that pumps blood to every part of our body. So if your muscles was restricted, squeezed, if your muscles has been damaged, it will leave you with a different complications. So some people experience different complications depending on how severe the heart attack was. So some of these complications can be irregular heartbeat. Some people might also experience a slow heartbeat, which we call the bradycardia. Some people fast heartbeat. So I've mentioned three things. So this complication, someone might end up having their heartbeats beating slowly. Others can also end up having it beating fast. Others too, it will be irregular. So these are some of the complications that someone can develop after having a heart attack. Another complications too can be a heart failure. So if you were not having any heart problem, but because your muscles are now affected, now damaged, you might end up having heart failure, which is when your heart is unable to effectively pump blood around the body. So your heart will be pumping blood, but it will not be as before, effectively as your heart was before you had the heart attack. So these are some of the complications, heart failure. Others too can end up having cardiogenic shock, which is is similar to heart failure, but it's more severe and more serious than heart failure. Your body is unable to pump blood to your body. So that's when a surgery will be done, and sometimes they'll put a pacemaker, some equipment in your heart for it to help your heart and be able to pump blood to your body. And if you're somebody who has had a heart attack and you're experiencing some of these symptoms I'm going to talk about the cardiogenetic shock, please, you need to speak with your cardiologist. You need to speak with your GP. You need to speak with the team that is, if you are still under them, that discharge you to the community or to your discharge you home. You need to speak with them. If it's after the 10 days, you can go back to your GP, to your doctor, who can then send a referral or do further tests for them to give the treatment to you as needed. So some of the symptoms of this cardiogenetic shocks are when you have mental confusion, you are confused. 1 minute you are confused of why you even went to the room to get something. You even forget things easily. Cold hands and cold feet. You were weeing or peeing or going to the toilet to wee normally, but after the heart attack, now you can see that there's a reduced in you going to the toilet to pass urine, to pee, to wee, it might be a sign that you went into a cardiogenetic shock. Pale skin, difficulty in breathing, and sometimes you have rapid beating of your heart or breathing. It can be a sign. If you've had a heart attack, then you are having all these symptoms, that it might be that your complications might be a cardiogenetic shock. So if we've now talked about the complications, we've talked about the treatments, we've talked about the preventions of the heart attack. How can we prevent it? Because that's the main reason why these programs are always viewed on a weekly basis, for us not to find ourselves developing this health condition. So we know what this complication is. We know what this the symptoms. We know the causes. We know the treatment. We know how the recovery stages. So in order for us not to develop or to end up having a heart attack, or someone that we know had heart attack, what can we do in order to prevent ourselves from having a heart attack? We can do this by eating healthy. It all boils down to eating healthy. We need to watch what we eat. Some people, we eat late. Immediately we finish eating, we go back to bed. We go to bed. I know, yes, sometimes we work long hours, but we have to find time to eat on time, to eat early, and be able to mobilize, to walk around, to be able to, for our body to have time to digest, for our body to have time to break down those fats. But if we just immediately we finish eating, we go have our bath and go and sleep, then that's when it builds the fat, and this fat end up blocking the vessels, blocking the vessels that pumps blood to our heart, and we end up developing heart attack or MI. Eat healthy, our vegetables, our fruits. We say, is it once a day or 5 a day? We need to try and eat vegetables. Check the food that we eat, not too much fatty food. We need to, if we smoke, if you're someone that you need to cut down the amount of smoke. Even if you can stop, it will be helpful. If you are having problems stopping smoking, you can speak with the nurse, your GP. We have smoking cessation nurses. If you don't want to go to your GP or your doctor, you are finding it difficult, you can go online. Just refer yourself. They will be there to support you. You can also try and control your blood pressure. Control your blood pressure. If you have blood pressure and you've been given medications, please try and take your medication. After using other traditional medicines and you feel your blood pressure is controlled, what you have to do is go to your doctor, go to your GP, who will assess you, reassess you, and if they need to reduce the medication you are on, they will reduce it. But then if they need to stop as well, they'll stop. But you don't have to sit at home and stop or listen to what others will say, because everyone's health condition is different. Even twins, if anything happens to them, it affects them differently. So you need to control your blood pressure by taking your medication, eating healthy. And also, if you are diabetic, try and check your sugars. Make sure that your sugars are monitored, are controlled, and you take your medication if you're on medication. We need to also, as well, if you drink, you have to make sure you don't exceed the limits, the intake of alcohol. And if you want to stop, there are help out there which you can speak to your nurse, speak to your doctor, speak to your GP, who will help you either reduce or to stop your smoking. Overweight. Outside some of the symptoms, some of the causes were overweight, obese. So if you're overweight, there are a lot of things that you can do in order, because when you are in order for you to be to lose some kilos, to lose some grams, because when you're overweight, your heart find it harder to pump blood around your body, which can then increase your blood pressure. Because when there's too much pressure on the heart to pump blood, then it raises your blood pressure. When it raises your blood pressure, then you end up either having a heart attack or having a stroke. So you need to try and control your weight. You can exercise. Now that we are a new year, there are a lot of vouchers, there are a lot of things that are going out there. They'll say, come and sign up. When you sign up, there are some percentages that you can have to go to the gym. If you don't want to go to the gym, I always say exercise. You exercise by walking, by swimming, cycling. There are a lot of things which are free. You don't need. I always say when you are going to work and other things, you can even decide to stop some 2 stops or 3 stops of where you were supposed to get off, or wherever you are going to get off, and just use that as your exercise and go and it will help you to reduce your weight. So we need to exercise. There are loads of things, and even thank God on ABL we have a weekly exercise regime which you can participate. Sometimes some of these exercises you just need to sit down, stretch up and all that. You don't need to do a strenuous things for you to know that you are exercising yourself. So ladies and gentlemen, as I said, heart attack is a very it's a very serious, life-threatening condition. And when you or your loved one is experiencing any of the symptoms that I've mentioned, please immediately call 999, ask for ambulance, and immediately they will come to your aid. When they hear heart attack, no 2 ways about it, they will come to your aid. If you think the ambulance will delay, as I always say, if you can drive the person straight to A&E, the best way to do is to drive the person to A&E, as time is very essential when it comes to a heart attack. So please share this information with your loved ones, and you might never know who you are going to say. So thank you so much for watching ABL Health Matters. Health is worth and worth is worth. And Happy New Year once again to you all and your family.